Hi, everyone. Welcome to this session. This is our fourth session, I believe, on caregiver, lunch, and unlearn, autistic adults and mental health. And just to let everyone know that this session is being recorded, and we will turn off the recording when we get to the end for questions and answers. So my name's Alexa, and I work at the Patient and Family Learning Space. And today we are going to be talking about unlearning advocacy. We are really delighted to be working with the Israeli Adult Neurodevelopment Center at CAMH to put these webinars on. And the Israeli Center is the first research and education center in Canada dedicated to improving mental health for adults with developmental disabilities and their families. The four pillars that they focus on is clinical innovation, research excellence, education and training, and knowledge exchange. Through partnerships with neurodivergent people and their families, the center strives to build capacity and explore new ways of supporting the mental health and well-being of this group. Today, we welcome our guest speaker, Michael Dawthorne, a caregiver and community and disability advocate and director at a social service agency. And guiding this discussion from the Israeli Center are Aideen, Nathan, and Leanne. And I am going to pass it over to you folks to take it away.
Get the next slide up. I am a settler and descendant of Loyalist refugees. I'm coming to you on the traditional territories of the Mississauga, Adirondack, Anishinaabe, and Lenape. I also live 60 kilometers east of Walpole Island First Nation, home of the Ojibwe, Ottawa, and Potawatomi, who form the Three Fires Confederacy. I encourage each of you to consider the lands and peoples where you're coming from and ally yourself to make positive change. Next slide, please. So Alexa kind of said all this, but just a reminder, this is not a clinical or therapeutic virtual space. We neither endorse nor oppose any specific therapies, treatment, opinion, service, or individual. And we are caregivers sharing real experiences that may be uncomfortable for some. We're going to start a word cloud, and if you've attended these before, you know we like to start off with those. So what does advocacy mean to you? And that can be whatever that brings up. If you want to put a definition that's in your head, a couple words, or how it makes you feel, you know, it's open-ended. So what does it mean to you? And we'll give you some time. Standing up for, fighting, truth-telling, championing. Oh, I can't say that. Championing, never-ending, rights. Yes, it's a big one. Uplifting. That's interesting. Fighting. Impossible. Inaccessible. Yeah. I'll give us maybe a few more seconds. Exhaustion, exhausting. Yeah, I feel that one. All right. Well, thank you, everybody. So, the official definition of advocacy is it's any action that speaks in favor of, recommends, argues for cause or supports, or defends or pleads on the behalf of others or ourselves. But as we saw, we all have different ways that we think about it. It elicits different feelings. We also recognize and acknowledge that we have different positionalities, such as racial, gender, socioeconomic, sexuality, and so on, that present different barriers and opens doors for others when it comes to advocacy. So we all come at advocacy from different places. Some of us may just be learning how to advocate for the first time, and some of us may have been doing it with and for our loved ones for decades. Some of us don't even realize we're allowed to speak up or question. Some of us may not feel that we have the capacity to further complicate things. There is more than one way to advocate. So advocacy is not a simple topic to explore, and our time today will barely scratch the surface, and we realize that. And Leanne is going to take it
Thanks.
over from now. Thank you.
Thanks, Nathan. The truth is that we are in a unique position as caregivers supporting the mental health of our autistic loved ones. We so often find ourselves advocating to people who have limited knowledge about autism and mental health. What, you might ask, are some of the obstacles that we face? Well, many of us struggle with the issue of consent. Does our loved one want us advocating on their behalf? Then there are times when we advocate to clinicians or organizations who really don't understand the unique role that caregivers can play in their loved ones' lives. We are not always seen as partners in care. Many of us have also been dismissed as overbearing or over-involved. Many of us have felt gaslit. But many of us, including myself, have been told on so many occasions that we are warriors. I've been told that I am strong, that I have Herculean strength. But honestly, when we use the word exhaustion in the word cloud, I am tired. I'm tired of feeling like I'm in battle all of the time. I'm tired of fighting to get support from systems and organizations that are in place for families like ours. How can I be strong? How can I be a warrior without being thought of as over-involved or overbearing? And why does advocacy have to feel like a battle? So, on that note, I'd like to invite my colleague and another warrior, my friend, Aideen, to discuss some of the battles that they have fought and that they continue to fight. So, Aideen.
Thank you so much, Liam. I'd like you to think of this story, my story, as a case study. So rather than it being, hey, I'm telling you about me, this is a case study. And my story of advocating for my son's needs began in London, England. And to set the context, he was born 16 weeks early, spent most of his childhood in hospital, and much of that on life support. And his prognosis for survival was dismal. I was and still am a single parent, and I advocated as his microphone and his interpreter to a team of about 20 medical, social service, and educational professionals supporting my son. And this circle of care worked really well while he was part of Children's Services. But jumping fast forward to the end of high school in the UK, he transitioned to adult services. He was diagnosed as autistic with borderline developmental delay. Now, that's the term they use in Britain for intellectual disability. He was also diagnosed as bipolar. And following his first suicide attempt, he was provided with supported housing through the National Health System in Britain. And my son initially settled really well into his new community living. He made friends. Then the complications occurred. And some of these were major, such as problems involving medications that had severe consequences, such as not being allowed to carry his asthma pump out of the building. And that resulted in lots of unnecessary hospitalizations. Other issues were less dramatic, but equally significant to my son, such as not allowing him his choice of being a vegetarian or disregarding reasonable adjustments. Now, that's the British term that they use for accommodations, such as helping him tie his shoes. Instead, they asked, how old are you? And when he requested help or actually asking for someone to listen to him about issues involving being teased or being bullied, he was thrown into a downward spiral when he was told, just ignore it. So I began advocating at his request. I started by speaking to the frontline workers. Nothing changed. I went to the supervisors, and nothing changed. I went to the senior management finally, and they seemed to take the grievances seriously. And they said that these things would be dealt with. They were, but not in the way that I imagined. I became the dreaded, complaining parent, and my son suffered further as a result, was victimized by frontline staff who did not disclose a full story to their supervisors. And my role as warrior was firmly established. There was no going back. And it so pained me to hear my son disclose the going-ons, knowing he had a voice, but it needed interpreting to be properly heard, and I could no longer do it. And I know that there was cross communication that could be resolved, but the only way that I could advocate was to step back and be silent. We moved to Canada. I'm still navigating systems here, but advocacy is advocacy. And I recognize that people and organizations that we advocate to have their own concepts of advocacy for their service users. And they may be equally interested in the well-being of our loved ones, but their interpretation of our advocacy and involvement in our loved ones' lives might be very different from our intentions. And honestly, I'm not a battle axe. And I understand how this was the interpretation. And once it was established, there was absolutely no going back. Now, today, we caregivers are very privileged to talk with someone who comes to advocacy from very many different perspectives. Michael Dawthorne comes to us as a caregiver of an autistic adult with multiple complex needs. He's the director of a social service organization. He also serves on numerous boards and committees, and he's received the 10th Anniversary Accessibility for Ontarians with Disabilities Award. So just in our brief conversation planning for this webinar, I had a taste of seeing things from an organizational perspective rather than my own, my short little conversation that I had with Michael. And it didn't change my realities of the situation, but I found that having a wider perspective was really helpful. So, Michael, in retrospect, do you have any thoughts about what people in positions like I ended up in could have done differently?
Yeah. So first off, I'm glad that you're not in that situation in England, and you've come over, and hopefully have some better services and supports in place. Although I know that's always going to be an ongoing battle. I'd also sort of like to build a little bit on what you're saying in terms of the different perspectives I have. Having worked, in group homes, having worked in management, having worked, served as a director, I've dealt with the angry parents, the upset parents, and been frustrated having to hear their complaints, and they're feeling like, oh, they're nagging about this, it doesn't go away. But I've also been that angry parent. I've been the one who sits there and says, this isn't good enough. And whenever I tell this story, I always say, and I was right in both cases, because there isn't a right or a wrong. The service providers really are there to try and support, our loved ones. In my case, my son, and they have systems in place that they're bound to sort of follow, and they don't always work. They don't always work and meet the needs of our loved ones. I apologize if I say, our kids. That's my perspective, so I'm likely to slip up and say that. I realize not every caregiver is, caring for a child or their child. So just apologies in advance. But I do want to go back, Adine, to your story and sort of what could we have done differently in the situation? What could you have done differently? Or what could you do now if you found yourself still in that situation? First off, the one thing that I tell people that I think almost nobody likes hearing is, as the advocate, you have absolutely no power. The agency holds all of the power, and we need to remember that. An organization gets to decide who they serve, how they serve them, and as much as we sit there saying, but, the reality is those agencies still have that power. It's a tremendous injustice in terms of what's in the best interest of our kids, our loved ones. We know what they need. We know what we want to see happen for them, but we don't have any control over what the service agencies actually deliver. So there's a few ways to kind of combat that. The easiest is to try and align yourselves. So try and have when they see you and when they interact with you, to see somebody that they want to work with. They see you as a team member who's trying to support your son in this case. And there's different ways of doing that. But if the service provider only ever sees you when you're upset, only ever sees you when you want something, when you're not satisfied, you very quickly become, you know, the warrior, as you refer to it. I call it the mama bear, you know, the angry parent. But if they see you some of the time engaging in their fundraisers or their activities, I talk with parents a lot about schools and say, you know, go to the bake sales, go to the book sales, you know, do these things. Even if you have no intention of buying anything, but you get seen as an engaged, caring parent or caregiver, and not always angry. And inevitably, you have conversations with people when you're there. And they get to know you a little bit. And that is probably the next most significant piece, is you can find a champion. And, you know, Adine, you talked about talking with frontline staff. Sometimes that becomes your champion. They have no power ultimately in the organization. They're not going to be able to make a lot of change, but they're going to be able to keep that voice alive a little bit when, you know, they're having team meetings and conversations and case conferences and whatnot. You know, I've been that voice professionally in my organization at times where I've been able to say, yeah, that's a frustrating situation. This person is being challenging, you know, for us to work with, whatever. But, you know, if it was me, I'd kind of be doing the same thing. I get it. You know, I understand why they want to do that. You know, that squeaky wheel kind of thing. And when I'm saying it, as opposed to the clients coming forward and saying it over and over and over, it's a little bit better received, because they can't just discount a staff person completely. They have to work with them. They have to engage with them. So you find that champion. It's not always a frontline staff. It's not necessarily even always somebody that you would necessarily think of as your champion. You might find a board member, for example. You might find, if it's a bigger entity like a hospital, you might find that they've got an accessibility coordinator, and that person gets it. You know, and you connect with that person and they get it. You know, and then you can kind of bring them in on stuff. One of the ways that you can actually shift some of that power dynamic, as I said, you don't have any power, they have all of it, is to bring in a third party. So if you're working with another organization who's also supporting your child or your loved one, and they're part of, you know, some of these meetings or team meetings or whatever, that power shifts, because the other organization that you bring is not seen as obviously biased. Like a parent is obviously biased. You're obviously going to want what's, you know, perfect world for your child, and you're going to completely, you know, in their eyes, you're going to be completely unrealistic and unreasonable. But another agency isn't. Another agency doesn't have these reasons to expect, you know, grandiose things. And the organizations have to work together. A lot of the time they will partner in care, they may partner in funding arrangements or grant proposals or things like that. They have to maintain a good relationship. So the power dynamic is immediately changed, because one organization doesn't hold all the power over the other one. The perceptions immediately change, because it's not the irrational parent, the warrior. It's somebody that they've worked with in potentially many, many times in the past. And so there's an inherent respect that's already there. So had you had that opportunity, Adine, to have another organization involved, you might have found that, you know, the housing organization that your son was at listened. The exact same recommendations, the exact same things being put forward, but they may have listened a little bit more. So that's always very encouraging. Nathan.
So I was thinking about this, and I'm wondering about perhaps like how you came to all this insight, because you didn't start out always as angry dad, angry mom. Did you think you experienced any unlearning on your own journey about advocating?
Absolutely. So the first sort of advocacy role I took on, as a caregiver was a parent rep for a municipality. It was representing parents of kids with disabilities. And, you know, I went in thinking that advocacy was all about, you know, the change and, you know, making sure that in that case, the municipality, but service providers understood what they were supposed to do. Like, I honestly thought it was, they just don't know. And advocacy was about educating. You just had to teach them what they needed to know, give them the information, give them, you know, point them to the legislation, that kind of stuff, and that they would do it because the law says they're supposed to do it, or that they have to do it. The reality is the law does say that in a lot of places, in a lot of cases, there's plenty of laws to support what we would ask for our loved ones. But it doesn't mean that the agencies are going to follow it. It doesn't mean that they're going to listen. So that was a big unlearn for me. When I talked about the power dynamic, that was another one. I thought the law is on my side or on my kid's side. I have all the power. They have to do it or they're going to get in big trouble. But I very quickly learned that's not the case. I have no power. And the best way to kind of shift that power dynamic was for me to get engaged with the system. So I'm a big proponent of trying to change the system rather than trying to get, you know, an exception for, you know, for my kid. I really very much believe that, you know, if it's not right for my son, it's not going to be right for the next person's kid or the next person's loved one. And so I try and get involved, which is why I'm on, you know, a bunch of different boards and why I do what I do professionally, and the number of committees and stuff that I've been on, everything from, you know, municipal levels up to international stuff. And it's really trying to make those changes, you know, sort of from within, because I recognize, you know, exhaustion and exhausting were both in nice large print on the word cloud, and I completely can relate to that. I honestly, you know, don't know when I last got 3 nights of sleep in a row, solid sleep in a row. That just doesn't happen in my world. But somewhere that energy to keep going comes, and it comes from talking to people like Adine and hearing her story and realizing that we have so far to go. And so I will keep trying to support people with that. I guess I will take more questions. I don't.
I think Leanne is had her hand up.
I did politely, which is uncharacteristic of me because I'm a warrior. So actually I have 2 questions, and I'm going to ask them both because I'm going to forget them both if I don't. So my first question is, once we can't all leave the country. So once we've sort of arrived at this person that we are seen as the battle axe, we're seen as the angry mama bear. If we can't leave the country, what can we do? Because it's not like there are so many options to go, okay, so I'm not allowed at this McDonald's, I'll just go to Burger King. Or so what does one do? And if I'm able to ask the next one so that I don't forget it. Oh my gosh, I think I forgot it. Oh no, it's that yeah, it's given that so many of us have loved ones with needs with complex care, I'd really love to have a discussion about what happens when our loved one is excluded from trials or it can't be part of a study or a group because of the not contraindications, but exclusion criteria. And do we have any voice in that when we sort of reach the end of the road? So, but I'd rather, if we only have time for one of those questions, and I would love for people to put comments in the chat box as well in questions. The first one I would love the answer to, if possible.
Sure. So let's assume, Adine, that you didn't leave, or that, you know, you were in Canada the whole time and you moved into our system and you still found yourself in that situation where you essentially, you know, it feels like you burnt every bridge. There's, you know, it's really tense, but you still know that your child needs support, and really, you know, as Lee said, Leanne said, there's nowhere else to go. right? You can't just cross the street and go to, go to Burger King instead. So that becomes a journey of repair, of trying to repair. And the reality is, unfortunately, at that point, probably your best approach initially is to grin and bear it, to not push them any further, because again, they have the power, they have the authority, and they could potentially decide, well, you know what, we're just going to discharge. We're going to find a reason to discharge from care. And without the Burger King across the street to go to, unless you're in a situation where you can receive, you can take on that ownership, which I imagine most of us can't. You don't want that to happen. So, the initial, just back off a little bit, grin and bear. They'll give you conditions. They'll tell you, well, for 6 months you must do this. For the next year, your loved one has to do this. Just shake your head, agree. Yep, fine. The reality is, that that's just not going to be possible. But don't argue with them at the time. Accept it at the time. In the meantime, start showing up at those bake sales and those book sales and the other things. Start getting that change in your image amongst some of them. Still continue to try and find that champion. So a lot of the things that I talked about. Hopefully, you've got another agency of some sort involved. Even if one does housing and the other one does some, let's say they do recreational therapy of some sort, like completely different things. Find a reason to bring them together on, a case conference where there's now that other professional voice that can represent you as not the warrior, can really bring things back to, no, we're not talking about warrior mom. We're talking about, child's needs and how all of us work together, the agencies, the caregivers, the family, the extended family work together to support the best interests. So you have that now neutral party that starts kind of filtering the message back and forth and softens the relationship. Then inevitably one of those things that they've told you has to happen for the next 6 months or a year or whatever doesn't happen. And I've been in that situation. I've had the phone call that says, remember, we talked about this. You said this, whatever. And I acknowledge that, yes, we talked about it. I don't acknowledge that I agreed to it. I just acknowledge that we talked about it. And then when I have to push back, I explain honestly why. I know, and I will acknowledge that I know this is not, that they're not happy with me when I'm doing this, but I really have to do what is in the best interest of my son at the time. And they'll get frustrated again. So it's kind of like you make some gains, you lose a bit, 2 steps forward, 2 steps back. But over time, as long as you continue to work towards, repairing that relationship, and you're really selective about, what can I tolerate and what can't I, it will help tremendously. The other thing that I would say, which is another, I guess, bit of the unlearn that I went through is, and it was mentioned in the opening, there's not one right way to advocate. So, agencies are often upset by the angry, the mama bear, the warrior, the iron fist type, this is what my child deserves, this is what my loved one deserves, this is what the law says, this is what they're going to get. And that is one approach to advocacy. I talked about basically a third-party advocate where you have another agency involved. If you have, I know we've used it in my family, we use the good cop, bad cop approach sometimes, where we'll go into meetings and literally before walking into the meeting, it's like, okay, are you the good cop today or am I? And it allows one side to push and say, this is what we want, and the other side to sort of say, yeah, but we can kind of accept this. So that's a key also in advocacy and the unlearn is what you're asking for and what you'll accept are rarely the same thing. And rarely will you get everything that you ask for. So you kind of need to know what it is, what's your absolute minimum, and that you're going to kind of aim for. It's almost like a negotiation. this is what we want, but we'll kind of take this. And then it also gives you the opportunity to give in on some stuff and be seen as more reciprocal in this, and still hopefully get your loved one what they need. This also, in terms of approaches, there's also what I call the poor me. I'm overwhelmed. I don't know where to go. I don't know what to do. I really need you, and you kind of put the plea into them, like, you're so respectful of them and you're so thankful for their support. Which when you're in your situation, or the situation you explained there, Adine, would feel very unnatural and uncomfortable, but sometimes it works. So, over time, hopefully developing a sense of what might be my best approach here, knowing your audience a little bit, knowing their own policies, what they say publicly is helpful. Some organizations are very transparent about, their clients' rights, their commitments to diversity and accessibility and things like that. And others, you can't find a thing. And, the more transparent they are, probably the more committed they are to it, and the more likely they are to have that empathetic, supportive approach. So the more you get to know them, the easier it's going to be. Adine, you got a hand up again?
Thanks, Michael. It's really helpful. I was wondering, in terms of when you were talking about bringing in another agency, possibly for support, and I found that's something that I tried once, and it's also along that line where I brought in medical practitioners that were advocating for my son. And that actually backfired completely. And I was told in no uncertain terms why. This is something between us. They do not know us. They don't know the way things work here. I'd like to ask you, with basically with your CEO hat on now, with the organization. So, if a parent then brought along somebody or a caregiver about their loved one, and they were then doing the iron fist, as it were, would you care about keeping the high profile with them, or would it antagonize you? What do you think?
So if I was the director sitting on the other side, and people brought in their other agencies, or their other supports, I can't imagine being the iron fist and saying no, I don't want them there. Even if I wasn't a caregiver and a parent in this situation, it just fundamentally goes against the whole concept of a client-centered approach. The client or your son is the one who should be able to dictate the people who are involved in his care. And I don't believe any agency has the right to remove that autonomy from anyone. So, as an organization, we should never have the right to take away, a client's circle of care. That's the worst thing that an agency can do. If they're really, really insistent on doing that, I think there needs to be a polite way of calling that out. Probably not in the moment, and probably not necessarily directly to that individual. Hopefully, they've got a public, complaint or comment process. Try and follow it. I will tell you that one thing that does aggravate me and does aggravate professionals is when people try and jump, either up the chain or elsewhere, because inevitably we will have them directed back into the channel. So if the complaint should be coming to me and you're going to someone else, they're going to send it back to me. But it's going to be a little bit irritating. It's like, what you're supposed to do, why aren't you doing it? Right? So it actually erodes that relationship that you're trying to build. Ultimately, one thing I want to make sure everybody does here is, regardless of the fact that I've said the agencies have the power, regardless of the fact that I've said, they can kind of decide what's going to happen and such. I don't want anybody to think that they should not speak up. You should absolutely still keep speaking up for your loved ones. Don't be afraid of being the warrior, or being perceived that way. I'm just suggesting that if you have the opportunity to soften that image a bit, you might get more success in what you're trying to achieve. But don't think of it as I have to trade that off for my child's best interests. No one should be sacrificing their kid's best interest, not long term anyway.
Michael, we have a question. Sorry if I interrupted. The question is, many service providers cannot speak with the caregivers or parents because our loved one, our loved ones here, we're talking about adults. How can you advocate in that circumstance? How can you advocate for them?
Yeah, so presumably, I'm assuming they mean because they're an adult, they have autonomy. You don't have any guardianship or legal power of attorney or anything. So there's a couple things. If it is a mental health piece and it's critical that the information is there, somebody they're in a mental health emergency of some sort, the Mental Health Act actually requires a service provider to get accurate and complete information. So if you know your loved one is not capable of providing that at the moment, maybe they have memory deficits, or they're just their intellectual disability, as Nadine talked about, would prevent them from being able to do that. The service provider actually legally has to talk to you, whether they have a signed consent, anything like that. So in some circumstances, they have to. Let's assume that's not the case, and you're just trying to get them to listen and hear some information that you have or whatever. In most cases, there's nothing that precludes them from hearing you. They just can't say anything to you. So I've said to lots of service providers, I'm not asking you to talk to me. I'm not asking you to tell me anything. I'm just telling you information that might be helpful to you. Some will choose to listen to you, and some will shut you down. They will still say, no, that crosses the line. And that's an ethical, professional decision they have to make. We can't make it for them. But my experience is most will still listen to you. They won't necessarily tell you, anything about what they're doing or how they're supporting your loved one. I would encourage as much as possible to get, to have your loved ones, when they're in, a good place and can, to consent, to openly consent, sign whatever's necessary with the service providers, so that when that comes up, they've got the permission to talk to you. Your child can always revoke that if they felt that they wanted to. Your loved one could always revoke that. But if you can do it in advance, it's going to be a whole lot easier than trying to advocate in a moment of crisis or high need. I don't know if any other questions came in, but I am mindful that I didn't get to your second question earlier around, if they're excluded from, a pilot or a trial, and what that can mean. The reality is that's going to happen almost all the time to, our population. So complex needs, whatever they are, because they've got multiple conflicting needs. And usually when they want to do a pilot or a test, they want a very narrow controlled group, so that they can be sure that what it is that they're trying to assess is really about the only factor in play. My experience, my instinct would say you wouldn't have a lot of success in trying to advocate for that. However, there may be an opportunity to actually use that to your advantage. One tool that is sometimes greatly overlooked in advocacy is all of the times where you've been told no, and all of the places that have said no, and all of the services you haven't gotten, or the number of places that have done an assessment and said, no, we're not the right agency. I venture to guess that for most caregivers of somebody with complex needs, that list is considerably longer than the list of people who actually provided any sort of ongoing sustained service. And then when you end up in a situation where you're at a hospital and they're saying, well, there's nothing we can do. And you say, well, okay, who can? And they'll give you a whole list of names. And you'll be able to say, well, yeah, we've been to all of them. They've all said no. So you can't discharge my child right now with nowhere to go, with no support in place. There has to be something. And for some professions, they actually legally can't discharge your child without some sort of a care plan or some sort of a referral somewhere. They have to give you something. Like it's part of their governing body. They cannot just simply say no. Sorry, Nathan.
I wasn't trying to cut you off. I was wondering though, that sound like we have there's a lot of discomfort when we see injustice, and even more so when it's somebody we care about. And we're fighting and we're angry. And do you have any personal advice or any insight into how do we sit with that discomfort? What are things, and I also, the caregivers or anybody else who wants to put in the chat what they do, please speak up too alongside Michael.
So yeah, absolutely. It sucks. The feelings suck. You sit there saying like this is so unfair. All I want is my child to, have an opportunity or have something even remotely close to what everybody else gets. And there's plenty of times where I felt so burnt out and so just hurt by the realities. I really encourage people, find something that you can incorporate into your life that you enjoy, that gives you some purpose. And for me, I describe it as like it re-energizes me. It gives me the energy to kind of keep going. It's not going to shelter me from the burnout days, or the nights where I just want to, like, yeah, that's it, I'm just shutting down. I can't do it today. Those days will still happen. Those are hard days when you don't have somebody else necessarily available to be on call or to support your loved one at the time. Even as a single parent, you probably don't have very many days where you can just say, I'm just closing out the world today. But really try and find those things. Don't listen to other people's judgment as to what those things are. Some people say, like, for me, I do a lot of advocacy and I join boards and stuff, and it's like, but you're just working, you're just doing more work, it's just more stress. It's like, there's a degree of truth to that, but at the same time, every time I know I inch a little bit closer to a better system out there for the next family, that gets me through another day. That makes me feel better in the moment. And then, like I said, some days they just, I just shut the world out.
Thank you, Michael. Adine has her hand up. Sorry, their hand up.
I'd like to speak. Thank you for that, Michael. And I'd like to speak to also what Nathan brought up, sitting with the discomfort. And one of the things that works for me, and I'm aware that it works for, I know a number of the people that are attending today, and knowing that probably this works for you too, is caring about the collective and knowing that even if we don't get the results, and we quite possibly won't get the results for our own loved ones, maybe we can do something. Maybe we can put our energy into more of a community focus, into whatever we can do, into advocacy for collective. I know this is something that Nathan and Leanne and I talk about a lot. Do either of you want to add to anything with that?
I have trouble with that still. I don't know that I am as virtuous as I'd like to be. I know that in our situation, my daughter will frequently become frustrated with me because I'm supposed to be the person to help. And I was always the person, as she was growing up, who fixed things. And she could come to me, and you reach a point in their lives and in your own life where you can't fix it anymore. And it's one thing to sit with that for yourself, but when you're sitting with that for someone you love, It's harder for me to look at the sort of the bigger picture. I do have a tough time with that, but I'm working on that. I'm going to read also some questions from the chat because I think I'm mindful of the time. Michael, does being deemed substitute decision maker by a psychiatrist have any real influence, control, or say? That's attendee 55. And they also are asking, how does a substitute decision maker compare to power of attorney for personal care?
So the power of attorney for personal care and a substitute decision maker are linked. A substitute decision maker is put in place anytime somebody does not have the capacity to make their own decisions. A power of attorney is a legal document that would say, in these circumstances, I become the substitute decision maker for this individual. So the first step is the professional has deemed that person not capable in that moment of making that decision. That can ebb and flow. So that's one thing people need to understand, is being a substitute decision maker in one situation or with one decision does not automatically mean you're always going to be the substitute decision maker. So, you know, someone's loved one might be able to completely understand the implications for consenting or not consenting to, say, blood work. And in that case, they're allowed to make that decision, but they might not be able to understand the implications of, you know, refusing a housing arrangement and what that would mean realistically. In which case, then the substitute decision maker would be enacted. It's actually a pretty complicated process, but ultimately, I would encourage people to get legal power of attorney put in place, so that in the event you're ever advocating, or you have reason to believe that your loved one may not have capacity at that moment, you can be quite successful in saying, you know, they have autism, they have mental illness, they have whatever. In my son's case, there's a developmental disability as well, and I'm the power of attorney. They can decide whether that gives you the consent to speak to them and for them to speak to you. Ultimately, it's up to the service provider to determine whether somebody has capacity to consent to their service. So when you say I have a power of attorney, you're not saying that you're actually the legal decision maker, but it's often perceived that way, and they will often invite you into the conversation. So you're not doing anything wrong. You're simply giving them factual information if you have a power of attorney. If they don't understand their legal obligations around substitute decision makers and powers of attorney, that's not your concern. In fact, it works in your advantage that they don't necessarily understand, because they then welcome you in, assuming that because you have a power of attorney, you're automatically the decision maker, which may not be the case depending on the power of attorney. Typically, powers of attorney for health are only in place when the individual does not have capacity to make the decision, whereas powers of attorney for property sometimes can always be in place, because somebody's capacity to understand money and finance doesn't tend to ebb and flow depending on their condition. Their ability to understand, you know, as I was talking about, different medical decisions and support decisions can vary significantly depending on the implication of the decision and, you know, their day-to-day function.
Thanks, Michael. We can give it one more minute to see if anybody has any more questions, and I'll pass off to Joanna.
I think I saw one more question in the chat, possibly. I have trouble getting supports for my son and daughter while they are attending college. They still need help during this time with relationships and social skills. Any suggestions would be appreciated.
Sure. So I would actually start with the college, or the college that they're attending. So something that's really changed a lot in the last 10, 15 years is post-secondary institutes really getting to understand their obligation to students with disabilities or with complex needs or different needs. So, reach out. They'll have some department or somebody who's responsible for maybe student services. They might have a specific accessibility coordinator of some sort. Find out what that is at the college and have a conversation with them. They may have programs at the college themselves. They may have something that they can support that way, or they may have connections within within that specific community that can support your child's needs while they're at the school or while they're attending school. But it is honestly, it's very similar to any other advocacy. Talk with the organization, be seen as much as possible as being an ally, and in all circumstances. And I will, maybe this will be the last nugget of what I think is truth that I will share. But when you're advocating, you're not always on the same page as the people that are around you, including potentially other loved ones. You may not always be on the same page as them. Try to remember that ultimately, even though you're not agreeing on what the right solution is or the right approach is, my headset just died. Sorry, even though you're not necessarily agreeing on the best, or what the best approach is, the right approach, just trying to remember that everybody, particularly when it's your other loved ones, is really trying to come at this as from what they believe is best for for your loved one, for the person that you're caring for. So although you might not be agreeing on what it is, you're actually very much aligned. You're both advocating for what you think is best for your child or for your loved one. And you can keep that in mind and that in perspective. And even remember that when you're face to face with these agencies, ultimately, as a service provider, we want what's best for the people that are in our care. We just may not agree with you on what that is. My partner and I may not agree on what's best for our child. But ultimately, neither one of us wants something bad for our kid. So if you can always keep that in sort of close to front of mind, it makes it a lot easier to work with these people who have a different opinion and a different perspective. Do you see a few other questions have popped up in the last 2 minutes?
I think Teresa has them covered. They're more specific advice. So thank you for sharing. Adine, would you like to give us a bit of a grounding breath? I know as a caregiver dealing with all of this and listening to it, of course it's all easier said than done. And there's a lot to think about. It elicits a lot of our own pasts and dealing with things. So you could give us your soothing voice.
Sure, I can give you a little happy ending story too, but basically, well, it's not that happy. Just last night, my son had to go to a psychiatric emergency, and it was just a wonderful conversation. It was a two-way conversation with the psychiatrist, with myself. We listened to each other. We worked together as family. I mean, it is doable. So I love being in Canada again. Anyway, grounding breath. This is a little mindfulness moment. Let's just breathe out, first of all. And just take a deep breath in. And breathe out. One more time. Breathe in. And breathe out. Thank you. Bringing you back to where we are.